Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Balata from Roots Community Health Center reporting for the week of May 1st, 2023. Following an update on COVID, I'll talk about some similarities and differences between COVID and the flu. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we're here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Starting with the global picture, the country with the largest increase in cases over the past 2 weeks compared with the 2 weeks before that continues to be Vietnam, now followed by Chad. Vietnam had a whopping 3,138% increase in cases. And according to news from Vietnam, Ho Chi Minh City Department of Education and Training has instructed teachers and students to wear masks in school. They also called on schools to encourage parents to get children vaccinated. And further north in the country, in Hanoi, masks are now mandated on public transportation and supermarkets, malls, gyms, restaurants, theaters, circuses, and bars. Here in the United States, a little over 30% of US counties are in the substantial or high transmission zone. This is down from 36% last week. Arizona and Puerto Rico are still almost all in the substantial to high transmission zone, and the majority of the state of California is moderate. The only area that is in high transmission is right there next to Arizona in Imperial County. Taking a look at provisional weekly COVID deaths. So remember, these are not confirmed, and these numbers will change as more data or documentation comes in. But so far, we are seeing weekly deaths coming down and finally now below our lows of last year around this time. We are seeing still over 1,000 deaths per week, but no doubt this is an improvement. So far, we have had 1,128,742 confirmed COVID deaths since the onset of the pandemic in the United States. And so far in 2023, we have had over 34,000 deaths from COVID. The good news here is that we now have a new weekly low, which was just recent, the week ending April 1st, 2023, with 1,303 deaths. It's hard to call over 1,300 deaths good news, but I say that because our previous low was a whole year ago. So it's good to see us doing better now than a whole year ago. Kind of a low bar, but we'll take what we can get and hope that this continues to decrease, but we will be keeping an eye on that as we head into the summer months when we typically expect to see an uptick in cases. Taking a look at current virus levels in our wastewater. First thing I want to point out here is that there are 124 new wastewater sites, which is good news. I'm hoping that every week when I report, there'll be more sites added. Also, we can see quite a bit of blue dots, which is another good thing. These represent lower virus levels, but we can also see that there are multiple orange and red dots scattered throughout the country. Now, looking at variant proportions, we can see that XBB.1.5, which was at one point projected to be around 90% of specimens in the US, is keeping on coming down. Now it's at 68.8%, seems to be getting edged out by XBB.1.9.1, which is now up to 9%, and XBB.1.16, which is now up to 11.7% projected percent of specimens. And remember, these are all variants of Omicron, and these are the most contagious Omicron variants, really the most contagious SARS-CoV-2 variants we have seen yet. We continue to see some regional differences, but nothing too notable to report here today. Here in Alameda County, we have 61 people in the hospital with COVID, 6 of those in the ICU, and a total of 2,232 confirmed deaths in Alameda County from COVID-19. Now I'm going to talk a little bit about the differences between COVID and the flu, because we keep hearing things like, isn't COVID just like the flu now? Isn't it similar to the flu? We hear these things in the media. So I just wanted to walk us through the topic because there are similarities, but there are also some important differences. The main similarity is that they're both viral infections, and these two infections can present themselves very similarly. Symptoms of COVID and flu can be anything from mild to severe, but they're similar. Cough, fever, fatigue, headache, body ache, shortness of breath, sore throat, even diarrhea can happen with both flu and COVID. Although with flu, we see diarrhea more commonly in children, whereas with COVID, we can see diarrhea at any age. And we know that loss of taste or smell is more common with COVID, although it's less common now than it was with the earlier strains of COVID, it appears. From here, things start to differ. First is how it infects humans. We know that with COVID, SARS-CoV-2 virus has spike proteins, and those bind to our ACE2 receptors. And those are receptors that are on many of our different organ systems all throughout our body. And this includes the lungs, but it also includes the heart and the liver and the kidneys and the brain and even fat tissue. So basically, SARS-CoV-2 can latch onto our cells of almost any of our organs. And with the flu has some proteins on its surface that kind of bind to acids that are on the surface of our cells that line our respiratory tract. So where SARS-CoV-2 can pretty much infect cells in all over the place within our body, the flu is pretty specific to binding to our respiratory tract. And next is the incubation period. So the incubation period is the time that it takes after you get exposed till you actually develop the infection and get symptoms. So the time between you get exposed to the time when you get symptoms is the incubation period. And with the flu, this period is much shorter. It's only a couple of days. So you get exposed to the flu, and within a couple of days, you know you got the flu. When it comes to COVID, the incubation period can be quite a bit longer. It's more like 4 or 5 days, but it can even be as long as 14 days. So there could be up to 2-week period between the time you get exposed to the time you actually show symptoms. But on average, it looks like it's about 5 days typically. So this means that the period of time before you get symptoms is longer. And unfortunately, so is the time period when you are contagious. And so I'll talk about that more in a moment. But about the contagiousness with the flu, when one person has the flu, they might give it to 1 or maybe 2 other people. And with SARS-CoV-2, this is actually a bit of a moving target, so it's difficult to say. Initially, we thought it was about 3 times more contagious, 2 or 3 times more contagious than the flu. But we've now gone through so many different strains of SARS-CoV-2, and each one has gotten more and more contagious than the one before it. But then on the other hand, we have a lot of people who've been vaccinated, people who've caught it before. And so this makes it a little bit tricky to figure out the true infectiousness of the actual virus of the strains that we're dealing with now. Best guess, I would say, is that one person could infect somewhere between 6 to 10 other people. But this is actually a very difficult calculation. I'm not going to go into the details about the challenges with this, but we will suffice it to say that SARS-CoV-2 is considerably more contagious than the flu, and this is very well established. It's also well established that SARS-CoV-2 causes super spreader events and outbreaks, much more so than the flu ever has. It can quickly and easily spread to a lot of people in one place. And then it sets off a number of different chains of transmission of each person who catches it. So it continues to spread to their contacts in their households and so on. And this is really not something that we see with the flu. The other big difference with contagiousness is going back to that incubation period. And this is important. SARS-CoV-2 can be spread by someone before they know that they have it. So before they even start showing symptoms, a person with COVID is already contagious. And So there's even people who get COVID and never get any symptoms, and they can also be contagious. But we think that much of the spread is happening pre-symptomatic, meaning after the person catches COVID, but before they know they have it, before they have symptoms. In fact, COVID starts spreading 2 to 3 days before you even get symptoms. And even worse, the peak infectious day, so the day when you're the most contagious, is the day before you start having symptoms. So this is one of the more frustrating things about COVID. A person with COVID is contagious before they even know that they have it. Their peak contagiousness is the day before symptoms, and their contagious period lasts for quite a bit longer than flu. So 8 to 10 days after their symptoms start, but it can be even longer than that. Flu, you usually start symptoms and contagiousness right around the same time. So once you have symptoms is when you're most contagious with the flu, and for those first 3 or 4 days after you have symptoms. So this is another reason why we don't tend to spread flu as much, because you usually get sick, you don't feel well, hopefully you stay home, you don't spread it around to other people, because the whole time you're contagious is the time when you actually have symptoms. You're not contagious before you start having symptoms with the flu. So again, this is one of the most frustrating things about COVID, because you're contagious before you even know that you have it. And that's why if you start having symptoms and then you test yourself for COVID and you're positive, you want to think about all the people that you've been around in the last 3 or so days, because those are the days when you were already contagious. And you especially want to think about who you were around yesterday, because they really need to be cautious and be testing themselves as well. Now, what about treatment? With regards to treatment, we are fortunate to have antiviral treatments that can be taken outpatient for both flu and SARS-CoV-2. So in both cases, just like really any antiviral treatment, the sooner you start, the better. As soon as you have symptoms, that's when you want to start the antiviral treatment, because we really want to start the treatment in order to stop the virus from replicating. And so to reduce the burden of that virus on the body and keep it from progressing into severe disease. And another important difference between the flu and COVID: reinfection. How often can you get these viruses? So with the flu, we typically don't see people getting it any more frequently than really once every few years. It's very unusual for someone to catch the flu more than once in a year. And that's because you're usually not going to see more than one strain of flu in your area in the same season. So once you get it once, you typically do have immunity against that strain, so it won't infect you again. There is always a slim chance you could see 2 different strains of flu, especially if you travel to a different area. So it's not impossible to get flu twice in one season. It's just very unusual. And like I said, usually most people get flu maybe every few years. And if you get vaccinated, your risk of that reduces as well. COVID, on the other hand, we actually don't know if there is any limit to how many times you can catch COVID. It doesn't appear that there's any limit to the number of times a person can catch COVID. We know that people can get it 1, 2, 3, 4 times, even within the same year. Protection wears off quickly and the virus mutates so rapidly. SARS-CoV-2 is not seasonal, it just keeps mutating and circulating. And we know that quite a bit of repeat infection is happening. And so that is creating an increased burden that looks very different than the flu. What about outcomes? So the flu is still a lot more predictable on who it's going to really affect and who is going to get more severe disease. We know that older adults, pregnant people, and those with underlying medical conditions, including children and infants, are at greater risk of having severe illness or complications of the flu. And the same is true for COVID, but COVID kind of has this added feature that it can result in hospitalization and even death, even in healthy people. And this has been another really frustrating thing about COVID since the beginning. It's been unpredictable from the start, and unfortunately, it does remain unpredictable. Some people who catch COVID will develop post-COVID conditions. They may develop multi-system inflammatory syndrome in adults, or multi-system inflammatory syndrome in children, MISC. And these are often otherwise young and healthy people who end up with a life-threatening inflammatory condition. We still don't have a way of predicting who this is going to happen to, and it can be very severe and life-threatening. And this is not something that we are accustomed to seeing with flu. Flu remains a little more predictable. What about complications? So there are a number of complications that can happen from the flu and from COVID, and most of those have to do with the lungs or getting what's called a secondary infection, which is another infection on top of the original infection. And what COVID can do, in addition to all of that, that we don't see with the flu, is it can cause blood clots in veins or arteries that can lead to embolism, strokes, and also that multi-inflammatory system condition in children or adults that I mentioned, which we don't see with the flu. So any virus can have lingering symptoms, and that includes the flu. So symptoms that kind of go on for longer, malaise or fatigue or persistent cough. And we're still learning about what this really looks like with COVID. But we know that with COVID, we're seeing post-COVID events like heart attacks and strokes or other types of clotting related issues. And we're learning more about this as we go. We don't know how to predict it. We don't know how to prevent it other than not catching COVID. And we really don't know how to treat it. So we still have a lot to learn here. And even though with the flu, there can be lingering fatigue or cough or so on, there doesn't appear to be a long flu type of situation like what we are seeing here with long COVID. Again, we still have a lot to learn here. And the effect of repeat infection may also lead to increased risks of this long COVID, which again, we're really not seeing that be a factor as it relates to the flu. Now, what about mortality rates? So this is something that thankfully has changed a lot since the beginning of the pandemic. In the early days of COVID, the death rate was about 5 times higher from COVID than from the flu. And thankfully, now we have vaccines, we have improved our clinical care, we have outpatient treatment. So we really have come a long way. But I wanted to point out 2 very recent analyses that attempted to answer this question about the mortality risk in COVID versus flu. And both of these studies really focused on people who were hospitalized. So these are the folks who were already sick enough to go to the hospital with either COVID or the flu. And then they took a look at the risk of death from there. The first one is published in JAMA, and it comes out of the U.S. Department of Veterans Affairs. And it looked at the time between October 1st, 2022 through January 31st, 2023. So really coming up to pretty recent now, which is one of my favorite things about this analysis. It makes it more relevant because it's looking at our current variants in a more current time period. They enrolled every individual with at least one hospital admission for SARS-CoV-2 or influenza, and where their admission diagnosis was COVID or influenza. They removed 143 people who had both. So you can get co-infected, you can get COVID and flu, and that is usually, that can be very severe. But in this case, they removed those 143 people from the study so that they could look at each separately. And what they found was that the death rate was 5.97% for COVID and 3.75% for influenza. So this represents that you are 60% more likely to die from COVID than for flu if you are admitted to the hospital with one of those conditions. So again, about 6% with COVID compared to about 3.8% with flu. It's important to keep in mind that this is happening in the context of 2 to 3 times the number of people being hospitalized for COVID compared to flu. So not only was there a 60% higher risk of dying if you had COVID compared to flu, but there was also 2 to 3 times more people being hospitalized for COVID versus flu. So this speaks to how much higher the overall burden of COVID remains, in addition to an actual increased risk in and of itself. The authors noted that early in the pandemic, the death rates were 17 to 21%. That was in 2020, compared to 6% now. So that does represent a humongous improvement. We should all be very grateful about that. whereas the death rates for flu were roughly the same, 3.8% in 2020, 3.7% in this study. And so we kind of have some predictability again as it relates to flu. COVID, we're getting a better handle on it. We're doing better clinical care. We have outpatient treatments, but the death rate is still substantially higher, and the number of hospitalizations and deaths is significantly higher. And so one critique I hear frequently is that the Veterans Administration population does not represent the general population. So I just want to address that right now. This study was comparing within that population between COVID and the flu. So we really don't have a specific reason to believe that we wouldn't see something similar if we compared another population that got hospitalized for COVID and got hospitalized with flu within the same study population. So in other words, it's okay if the VA population might be a little bit different in characteristics to another population or the general population, because we weren't comparing the VA population to the general population. We were comparing the VA population to itself and the results within the system for having COVID or flu within that population. Second, I just want to say that I think we owe a debt of gratitude to the team there that has been really putting out a lot of timely and important publications. I've reviewed a number of them here. The VA has a unified medical record, which is something other countries have, but here in the United States, we don't. So instead of saying that the VA population doesn't represent our overall population, maybe we should be saying that some kind of universal health coverage in this country would be nice, but at least certainly some type of standardized reporting would be nice. And so until then, I know I'll continue to take a look at what comes out of the VA and put it into the proper context. This next study comes out of Brazil, and I thought this one was really interesting because it was a nationwide ecological study where they also were looking at the case fatality rate and also the risk of death from COVID versus flu. So just for a little bit of background, Brazil has had some of the highest incidence and mortality rates from COVID in the entire world. And they have this public database established by the Brazilian Ministry of Health for the surveillance of respiratory illnesses. So it is apparently a de-identified patient database. And I don't speak Portuguese, but I did do some digging around, and it does appear that this database is still up and functioning, and there still are reports coming out of it. This particular study looked at the first 10 weeks of 2022, so January 2nd to March 12th, 2022, where they had over 7 million cases and over 35,000 deaths from COVID. They also had a flu outbreak at the same time. Now, it's important to note that vaccine coverage for the Brazilian population against COVID at that time, the beginning of 2022, was about 67%. So that's pretty good. Actually, it's better than the United States, if I recall correctly. And to figure out the case fatality rates, that means that they're going to look at the number of deaths divided by the number of cases. And then the second thing they looked at was the risk of death, comparing those again in the hospital with COVID compared to those with flu, and looking at the risk of death. And during those 10 weeks, first 10 weeks of 2022, they had over 99,000 patients with COVID and over 4,700 patients with flu hospitalized in Brazil. So again, this is about 20 times more hospitalizations from COVID compared to flu at that time. Remember, this was during the original Omicron surge. There were a total of 29,727 COVID deaths and 852 influenza deaths. And so that corresponds to 30% case fatality rate with COVID and a 17.8% case fatality rate with flu. So that's about a 70% higher case fatality rate with COVID compared to flu. And the highest mortality rate for both COVID and flu were among men. It was among people of African descent and among people over 80 years of age. So this does not sound unfamiliar at all. And now remember, it only looked at the relative risk of death for people who were hospitalized with COVID versus flu. And it turns out that those patients with COVID had about double the risk of death compared to those hospitalized with flu. So this was during the time of Omicron again. So it's a little bit older data, but it's not that far off from what we just saw in the VA study, where there was a 60% increased risk of death. In the Brazilian study, there was a 100% increased risk of death. So once again, COVID is not the flu. They're actually quite different, even as it relates to the fatality rate. And the biggest impact we can make, I think, I want to say that it's important to note that these two studies I just looked at were talking about the death rate for people who get hospitalized. And so I think we need to really pay some attention to keeping people from being hospitalized in the first place. And because once you get to the point of needing to be hospitalized, we can see that the risk of death is not insignificant. And we still have far too many people being hospitalized due to SARS-CoV-2 every single day. In fact, even though hospitalizations are in a lull right now, just like they've been every April pretty much, we have today over 3,400 people in the hospital with SARS-CoV-2. And we can prevent people from ending up in the hospital by, well, first of all, avoiding catching it in the first place, being fully vaccinated, and this is important, making sure to get outpatient treatment if you are someone who is at risk. So if you're over 50 or you have an underlying condition, you are someone that should probably get outpatient treatment for your COVID infection. And most people dying of COVID these days have not gotten outpatient treatment. And that is just not acceptable when we have treatment that reduce the risk of hospitalization or death very significantly. And we want to prevent people from getting into that next phase of COVID where it's inflammatory, it's affecting perhaps any and every organ in the body, and where it can be severe and have a risk of resulting in death. We want to stop it in its tracks. We want to stop the virus from replicating. That's why we take antivirals like Paxlovid or remdesivir or molnupiravir, and I know I review those almost every time, but we should do everything we can to make sure that we don't lose anyone else, especially for not taking a medication that should be perfectly accessible to everyone. So if you get sick, you have respiratory symptoms, you might ask, why should I care if it's flu or if it's COVID or if it's something else? Well, first off, if you're someone who should be treated, of course, it's very important for you to determine what you have because that will determine what treatment you get. And as we've said numerous times, we really don't have time to be wasting here. You got to start treatment as soon as possible. And the antiviral treatment, Paxlovid, has to be started within 5 days of symptoms. Secondly, which infection you have does weigh into how careful you need to be about spreading it to others. We don't want you to spread any illness to everyone else, but we know that COVID is incredibly contagious. And if you have it, you do need to go to extra lengths to keep from spreading it to others, particularly those in your household. And last but not least, it may determine your future booster timing. If you catch COVID, you could consider delaying your booster by 3 months from when you started symptoms, because getting a COVID infection does give you some protection, and there's no reason to get a booster shortly after you get infected. There's, of course, other reasons you might want to document what infection you got, including in the event that you end up with longer-term symptoms. It's just better to know than not to know. There are now some home tests that have been approved by the FDA that will check for both COVID and flu. I'm not too sure about pricing or availability at the moment, since I know the company who got the tests approved was having some troubles. But if you go to your primary care doctor to get tested, they should be able to send off the specimen to check for a number of different respiratory illnesses, a whole panel of them, which would include influenza A and B and SARS-CoV-2. So if you do go to the doctor to be tested, make sure to ask about that. And if you don't have a primary care provider, please get one, know how to reach them before you need them, make a treatment plan. So in summary, we are in a lull with SARS-CoV-2, as we have been every April for the last few years. We can be grateful for it, but it doesn't mean let down our guard, because there's still quite a bit of it circulating. And with the dropping of so many precautions, we are seeing outbreaks, and we are still seeing too many people being hospitalized, still losing over 1,000 people in the United States every single week. We would also be wise to prepare for increases over the coming months. And we are still learning every day, every week about post-COVID and long COVID and all of these things, and still learning about all the effects of repeat infections. So if you'd like to avoid a potential bad outcome or potential post-COVID or long-term COVID effects for yourself and others, please do what you can to avoid getting infected or reinfected or spreading it to others. Gathering outdoors is always safer than indoors. Make efforts to improve your indoor air quality. Take a look at the ventilation, open up some windows. If you must spend time indoors with others, especially members of the public, wear a high quality filtration mask like an N95, KN95, or KF94. Consider using rapid tests for pre-event testing. If you get exposed or you have symptoms, repeat the rapid test every day or two while continuing to wear a filtration mask. If you or someone you spend time with unmasked who would be treated if they got COVID, go ahead and get that more definitive PCR test to facilitate timely treatment. Remember, you've only got 5 days. Please don't show up to work or school feeling sick and exposing others. Stay home and rest. Remember to eat a balanced diet, incorporate fruits and vegetables, avoid sugary drinks, consider a multivitamin supplement, get your blood pressure and baseline labs checked, like your sugar, your cholesterol, your vitamin D, get some regular physical activity. Unless you're sick, in that case, please get your rest, manage your stress levels, and get a good night's sleep. This concludes today's People's Health Briefing. Thank you so much for joining us, and we'll see you again next Tuesday at 10 a.m.